Hello and welcome to Fragadam. My guest today, Dr. Negussie Deyessa, is from the School of Health Sciences of the Addis Ababa University. And yes, he's here for a conversation on COVID-19 in Ethiopia, which continues to be quite alarming. Dr. Negussie, a very warm welcome to the program.
Okay, thank you very much.
It is alarming, is it not?
It's true, yeah, it is going on increasing from day to day, both infected as well as people who are dying. That is alarming to all of us, even for the people that is now coming to each of us. People who are near us are dying of it. It's difficult to say this is alarming.
So when you say, I mean, so is the healthcare system a little bit too stretched because of the number of patients that it is accommodating, you think?
Of course, there is a lot, but there is increment in general the number of people who are infected, but the severe ones are the one that may come. They come due to symptoms related to other conditions, so they may be treated as pneumonia cases, as this relapsing fever, and so on. There are a lot of things that are diagnosed. People are saying that I have typhus, but after certain, when they are tested, they become positive. That is the reason that we are not seeing them directly. But if we see to the number of people who are coming to hospitals, it is still increasing. So the issue of COVID may be one.
Yeah, it's been a little over a year now since the first case was reported in Ethiopia, right?
Yes, yeah, correct.
And I had a number of professionals like yourself on this show over the last three or four occasions, and they were relating to me those stories of massive inflow, if you will, of patients to a number of hospitals in Ethiopia, which were ill prepared.
Yeah, when we start, it was difficult and it was unknown for everybody, and people were coming with problem, and at the onset, no one knows about COVID, and because of that, people were trying to keep themselves uninfected, and they were trying to follow these measures that are important for the prevention. But later on, when they see that those who were young were not getting infected and getting illness, people become reluctant, and the economy also has made people to withdraw from the preventive mechanism. And there are also a lot of things that are important. Since then, we have learned a lot from the Europe, and the treatment, the mechanism of prevention was at the initiation was very good, especially the prevention, but the medication also has become better. But the problem is there is wave, the wave of infection. Wave of infection or epidemic is when the number of susceptible people increase, presence of a single or minute number of cases can infect many people, and at that time, the hospitals and institutions will fill with COVID patients. Later on, when the number of susceptible people decrease because of most people are infected, again it will go down to non-endemic form. That has flown, and based on that, we have got this is the second wave of infection in Ethiopia, which is served in Europe and the United States. Such conditions exist, and nowadays this is at the end of the second wave. Hope down again in 1 or 2 months.
When did the second wave start, you say?
Yeah, it started on almost in January. In last January, it started to grow. Number of patients started increasing. Then in January, February, it increased much. In March, it was very, very high, and still it exists. And I hope in the coming 1 or 2 months, it will start being down.
What are the factors for the sharp increase? I mean,
This is
I know, but can you be more specific on this?
Yeah, this is based on susceptibility. Susceptibility means people who are not immune at all increase in number, and at the same time, because COVID will stay with a person for 2 to 3 weeks. After that, there will be no more infectious person. But after 2 or 3 months, again, number of susceptible people who can get infected who are not immune will be increased. And presence of 1 or 2 people results in the increment of, again, the other wave. That's what usually we find in epidemic form, in infectious epidemic form. The same thing happens, for example, in meningitis, in measles, and in COVID is the other thing. Usually in COVID it's shorter when you compare with meningitis and with malaria. In meningitis, malaria, and measles, it is because, especially in measles, it is because it's a lifetime immune system. But in COVID, after certain people, again, the immune system will fail, and that will result in acquiring again a new virus which will affect many people. When number of people infected increase, the number of people who want to go to hospitals to a special care will increase. That may be a problem for the treatment of the COVID because of the absence of oxygen, the absence of hospital and ventilation and so on.
How well prepared? Well, that indicates that we were not that prepared for the second wave. Is that correct?
It is on one hand, and the other thing is because we do have a scarce resource. We do have scarce resource. This is, we do have only 1 hospital or 2 or 3 hospitals in each big cities, and the number of oxygen tanks is very minimal as in a low income country, and the ventilators are also few, so such conditions are difficult. On the other hand, people's perception about COVID is changing because of the other conditions like related to this crisis, social crisis and the war. And because people are dying because of the war and because of the crimes, such conditions are making people reluctant to the prevention of COVID.
What are they reluctant to do? For example, talking about testing. Are people getting tested, do you think, much more than they used to?
It's not. Yeah. In developing countries, the other problem is only few people are getting tested. This is because it is almost a passive type of testing. When people want to be tested, they go and be tested. But if the Minister of Health and the Minister of Health was working well, they could have done testing and the tracking and isolating and so on, the quarantine, everything should have worked. But this time, people who are who want to get tested go to health buses and are tested. And these are people with symptoms, people who want for job, or people who want to go out of the country are being tested. But other than this, there is no good surveillance to trace people who are in contact with the case of COVID, and this is a problem.
In the beginning, it seemed like you were strong on that front. I mean, in terms of surveillance and contact tracing, right?
Yes, correct. That was what we were doing. In the first time, people having a little sign and symptom were encouraged to be tested. And when once if they become positive, the government was trying to trace people, individuals in contact with that person, and they were tested. And if they get negative, they were quarantined for a certain period, from 10 days, 14 days, and that has increased the we have had a strong surveillance system, but nowadays we are not doing that.
Why? Why do you think is the case?
This is because of the increment in number, and the system was not decentralized to give power to the districts, the Warada. If the Warada was working well from its beginning, then this could have gone stronger. But it was the federal government that was giving, that was working alone. And for the federal government, it was too few at the onset, but now it is too many people. So that has made the federal government not to go beyond this. The capacity of the federal government is relatively low. If there was a good decentralization at the Warada level, this we could have tried to uh, this stop. We could have mitigated it, but we didn't.
Are they doing anything about it to help to make this to have this done at the local level?
Yeah, the federal government is pushing the Warada, but the Warada is not working as we wish.
Right.
That is because of the capacity. The capacity at Warada level is relatively lower, or they don't know their work, or I don't know. But I don't.
Interesting.
Yeah,
So we have new variants, right, of this strain, right?
yeah, but we don't know about.
In Ethiopia.
Yeah, yeah,
Have you done any research on that?
yeah. We didn't. Yeah, the capacity of our laboratory may not work for that. I think we have seen strains to virus strains to South Africa or to anywhere, but I didn't hear anything about that. But if we see to this one, that may be also, as I mentioned, as the wave or increment starting January, it may be due to increment in susceptible people on one hand, and the other possibility is the introduction of this is possibility of new variants. If the new variant comes, the new variant, especially from South Africa as well as from the England, has increment in infectiousness and increase in this fatality, and it has also it has lowered response to previous illness. That is, the immune system is going down. What we have developed immunity from previous illness doesn't work when it is in the new variant. Even the new vaccine doesn't. The vaccine is not providing much to such variants. This is because of the mutation that is done. It is made on the virus to its receptor.
Speaking of vaccines, we have what do we have in Ethiopia? How many types do we have in Ethiopia now?
I hear there is two. One is from China. I don't know about it, but the one that we know is this
AstraZeneca.
AstraZeneca is the one that by export. That's what we have taken, and until now, almost 500,000 have been vaccinated. Most of them are almost 500,000. This is 500,000 in the country. It is just taken for in the last 2 months, and AstraZeneca has it is relatively good, good efficacy, and that it will reduce the death rates, the hospitalization, and the severity of the illness. Also, the infectiousness may be about 60%.
Are people encouraged to take those vaccines?
Yeah, at this time, I don't have any knowledge about that. We are encouraging, and people are taking it, especially at this time, health professionals and people above 65 and people with diabetes mellitus, hypertension, and or this comorbid illness are taking it, and it is encouraging. It's encouraging.
It's very interesting. So this is, I mean, the global South, in particular Africa, is suffering heavily from this, right? I mean, we don't have the vaccines. The vaccines are not available as much as we need them, right?
Yeah, we don't have the vaccine, but the available vaccine also is not taken properly. For example, Ethiopia has got almost 2 million AstraZeneca, but we have provided only for 500,000. And we have got also this vaccine from China. I don't know the number, but we are not taking that one. The capacity, it's not the capacity actually. We don't know, but maybe lack of distribution or lack of awareness of people, and it's not advertised to take it. The minister has announced once, but I never heard about that.
So, I mean, when do you think we'll be able to see the flattening of the curve?
Yeah, this is on one hand, it is difficult, but it's possible in the coming future. Yeah, this is because the vaccine may work, although it is fitting for the new variant. It's working. So as time goes and as the number of susceptible people, number of people who are immune increase, there will be a production of herd immunity. Herd immunity is a variant where when the number of people who are immune increase in the population, the virus starts difficult to find people with susceptible people. With that time, it starts to stop, or it starts to go online. That is to flatten. But it is difficult at this level. We didn't see until now in any country. There are countries in Asian countries like Vietnam, Taiwan, and the people who have the South Koreans who have stopped it. This was they started this containing in the early stage, and they have stopped it. But regard to the Western, until now they are in a problem.
It is true. What lessons do you think we have got to learn from the experiences that, for example, you just mentioned in the Far East? What are the specific lessons that we need to we can learn from those experiences, you think?
Yeah, in the Asian countries, they started immediately when the epidemic started in China. They were preparing for it, and they started containing in the first phase of the infection. Almost they have got only hundreds infected, out of which countable 7 to 10 or 20 people have died at a country level. This is because of they have started at every level. When you see to the European, they were uh, they were not prepared at all, except Germany. It started the Germany started prepared, but they failed to continue the preparation because of the lockdown. It was difficult. The communication between countries was difficult to stop. That has made the again go up. There are countries like Sweden, which they thought that herd immunity may be important. Because of that, they didn't do any lockdown at a country level. What they did was individual level prevention. They have educated their people to do this hand washing and mask, face mask wearing, as well as this distancing. This was what they did. But later on, the number of days at this time is very, very high. When you see to number of people who are infected and positive tests are higher in Sweden until now.
So you think we are a long way from that?
Yeah, in Africa it is indifferent. In Africa it is different. It's not because we are taking measures, but the number of people who are infected are relatively fewer compared to what is going on in Europe and in the West, the Western United States. This may be due to the population. In African countries, there is only young population. For young population, people may get infected, but only few are with symptoms, and those with symptoms are mild to moderate, and only few people are getting the worst type or the symptomatic as well as severe form. Because of that, we assume that we do have only few people. If you see to the prevalence again, if you see African prevalence compared to European prevalence, it's almost similar, but the days rate is very, very different. In African countries, the days rate is relatively lower. It is lower, very, very lower than the European. This may be due to the lower number of older people in Africa.
That's very interesting. I think on that, we've got to end this discussion. Thank you very much indeed. It was really a pleasure having you on my show, Dr. Negussie. Thank you very much indeed.
Okay, thank you very much.